Hello, my name is Keisha Britton. I am the facilitator for Nursing 4199 Transcultural Nursing. This podcast will discuss developing cultural competence. If you have questions or comments after listening to this presentation, please contact me at kbritton5 at capellauniversity.edu. What is cultural competence? Our patients come from many different races and ethnic groups, which means they often do not have the same beliefs about health, wellness, and illness. Nurses increasingly care for and communicate with patients of varying backgrounds. Culture shapes the ways in which patients express, experience, and cope with health. Cultural competence is the process used to demonstrate awareness and understanding of the patient's cultural background. The nurse must continuously strive to work effectively within the cultural context of the individual, family, and community. Cultural competence encompasses the behaviors, attitudes, and actions of nurses which acknowledge the fundamental differences in the ways patients respond to illness and treatment. The three stages of competence development are culturally incompetent, culturally sensitive, and culturally competent. Cultural competence is developed when persons become knowledgeable, committed, and skilled in individualizing care to meet the needs of the patient. Developing cultural awareness is a continuous process that challenges nurses to adopt new ways of thinking and performing. Key attributes for developing cultural competence are cultural awareness, cultural knowledge, cultural understanding, cultural sensitivity, cultural interaction, and cultural skill. Cultural awareness is described as understanding your own culture, your ethnocentric views, biases, and prejudices. You should become aware of similarities and differences among cultures. Cultural knowledge is enhancing your knowledge of cultures other than your own. You should be able to recognize differences in communication styles and customs between and among cultures. Becoming familiar with conceptual and theoretical frameworks will provide a basis for seeking information regarding cultural influences. Cultural understanding is the ability to recognize how culture shapes beliefs, values, and behaviors. Nurses should increase awareness of racial, ethnic, and cultural variations. It is essential that one understands that concerns may arise when your values and practices differ from others. Cultural sensitivity is the appreciation and respect for individual patient beliefs and values and the act of displaying acknowledgement of diversity through genuine care practices. Cultural interaction is engaging in clinical encounters that expose you to patients of diverse cultures. Cultural skill is the ability to perform cultural assessments in clinical settings to consider the beliefs and values, family roles, health practices, and meanings of health and illness. Cultural skill aids nurses in developing care plans that accommodate the values, beliefs, and practices of the patient. Each of these attributes supports the nurse's role in advocating for quality patient care. Cultural influences. The population of the U.S. is increasingly diverse. Changes in immigration laws and policies have increased migration and contributed to changes in community demographics. The 2000 census reported that more than 13 million residents migrated to the U.S., which averages to 1.3 million per year. Diversity is a global phenomenon that will contribute to greater diversity across the world. As demographic shifts continue, nurses will need to be prepared to develop the necessary skills to promote health. Importance to nursing practice. The nurse's culture often differs from that of the patient, which leads to different understandings of communication, behaviors, and plans for care. Nurses who become culturally competent enhance their knowledge, skills, and abilities. There are 4 principles that guide the incorporation of cultural competence into nursing practice. The first principle is that care is designed for the specific patient. The second principle is that care is based on the uniqueness of the person's culture and includes cultural norms and values. The third principle is that care includes the strategies to facilitate patient decision making in relation to health behaviors. And the fourth principle is that care is provided with sensitivity and is based on the unique characteristics of the patient. Becoming culturally competent improves communication, provides treatment that respects cultural differences, and enhances the quality of patient care. The goal of transcultural nursing is to develop a culturally competent practice that is congruent with the cultural beliefs, values, and practices of the patient. Cultural assessment models. Cultural assessment models are methods used to systematically identify the beliefs, values, meanings, and behaviors of patients while considering their history, life experiences, and social and physical environments. These tools aid nurses in conducting patient assessments to gather data from the patient's point of view. A continuous cycle of reviewing perspectives, practices, and processes will guide the nurse in developing effective nursing care actions. Leininger's sunrise model is depicted as a sunrise enabler which discovers culture. The model portrays the major elements and interrelationships of the cultural care, diversity, and universality theory. The sunrise model is symbolic of the rising of the sun, which represents care. The model is used to generate new knowledge. Assumptions of the model are that cultural expressions, meanings, and patterns are diverse and that commonalities exist among and between cultures. This model is applicable in assessing and caring for individuals, families, groups, communities, and institutions in various health systems. Geiger and David Heiser's model focuses on evidence-based, culturally competent practices with the patient as the center. The 6 cultural phenomena that are explored are communication, space, social orientation, time, environmental control, and biological variation. The model recognizes the diversity among groups and that every individual is unique, and it examines the variations that exist in the perspectives of patients and caregivers. Capena-Bacote's process of cultural competence in the delivery of healthcare services model focuses on the process of developing cultural competence. The self-assessment model is based on 5 domains. The acronym for the model is ASKED. ASKED. Cultural awareness, cultural skill, cultural knowledge, cultural encounters, and cultural desires. Nurses use this model to develop abilities to work effectively within the context of individuals, families, and communities from a diverse background. In summary, the incorporation of components of cultural competence into nursing practice provides the opportunity for the nursing patient to have a high-quality healthcare experience. The value of the experience is increased because it promotes culturally relevant care. So remember that culturally competent nursing care improves nursing practice and it improves healthcare. Some key terms are listed for you to better improve your understanding of terms associated with cultural competence. Please define and identify examples of each of the key terms. The key terms listed are cultural accommodation, cultural brokering, cultural conflict, cultural desire, cultural imposition, cultural preservation, cultural repatterning, cultural shock, ethnocentrism, prejudice, racism, and stereotyping. We move to the vignette corner. We'll describe a case scenario and then provide questions for you to assess your knowledge. Nancy Than was concerned about her father's health and accompanied him to his appointment at the clinic. Home health services had been provided for her father since his discharge from the hospital 2 weeks ago. Her father had requested that his diagnosis not be shared with his family. The father confided with his longtime physician that he did not want his family to be concerned with his cancer diagnosis. He shared that he feared that he was dying. He did not want his family to know the bad news. He refused treatment because he believed that people never got better after they were diagnosed with cancer. They always died. Questions. What are the values, beliefs, and practices that influence health for this cultural population? How would you respond to this patient's wishes? How would you include the family in the patient's care? How would you use the cultural assessment models?